Assalamu alaikum. Hi everybody. This is Joanna Masad. Today, inshallah, we will talk about the muscles of the facial expression, their innervation, and the blood supply of the face. So, as we know, this group of muscle is called muscle of the facial expression because they express our feeling or behavior, reflect our feelings, okay, or interaction to the environment. This is happened by those muscles are inserted to the skin, mainly inserted to the skin, or they have attachment to the skin. Okay. First muscle here, this muscle. This is frontal belly of occipitofrontalis muscle. It is attached or take origin from gallia aponeurotica, this aponeurosis, flat sheet of aponeurosis, and the other attachment in the skin over the eyebrows. There is another belly here, this one, occipital belly of occipitofrontalis attached to the superior knuckle line, so it has a bony attachment, okay, and then inserted into the gallia or gallia aponeurotica. Both muscles, when contract, they elevate eyebrows and make the transverse wrinkles of the forehead. This muscle is supplied by the facial nerve. This muscle here around the orbit is called orbicularis oculi. Orbicularis oculi. It also has two parts. The upper part here, it's called orbital part, and here in the eyelid it's called palpebral part. It's like a sphincter. The action of this muscle is to, the palpebral part is to close the eyelid gently, and this is the orbital part to close the eye forcefully. This muscle is called zygomaticus minor. Zygomaticus minor. Okay, it arises from the cheekbone or from the body of the zygomatic bone. As you see here, it's just like continuation of the lateral fibers of the orbital part of oculi, just like it continues with this part of fibers, zygomaticus minor. Then below it we have zygomaticus major. This is zygomaticus major muscle, okay, also from the body of zygoma and inserted to the angle of the mouth. Here we have risorius muscle. This is risorius. It's just superficial to the oxynator muscle. Okay, this is risorius muscle. It also attached to the angle of the mouth. Here is transverse nasalis, the transverse nasal muscle. Here, this one, okay. Here is levator nasae labii aquinae. This one, levator labii aquinae, and here is below to the this muscle here, This is levator levae superioris. Levator levae superioris. Here is depressor anguli oris. This triangular muscle here. Depressor anguli muscle. And here is depressor levae inferioris. Here is mentalis muscle. Okay. So zygoticus major and minor, mainly zygoticus major is called laughing muscle. This is for laughing. It's called laughing muscle. So it raised the part of the upper corner superiorlaterally. Okay. The risorius also called smiling muscle. Smiling muscle. Okay, because it take or retract the angle of the mandible posteriorly and laterally. Depressor labiae inferioris. This is depress the lower lip. Okay. Mentalis protrude the upper, the lower lip again, like in the sad face. Okay, so it protrude the lower lip. Then we have orbicularis oris, and this is for like a sphincter and for close the orbital fissure. Okay, this is the main muscles shown here in the flag stick model. I will show most of this muscle in the plastinet. Here is orbicularis oculi, orbital part attached to the margin of the orbital bone, and then here is palpebral part and the superior and inferior of eyelids. Here is zygomaticus minor, this one, zygomaticus minor. This is zygomaticus major. Transverse nasalis. Part of orbicularis oris. Depressor anguli oris. This is depressor anguli oris. Orbital part, orbicularis oculi. Palpebral part, zygomaticus minor, zygomaticus major, levator labiae alacoinese, levator labiae superioris, orbicularis oris, depressor anguli oris, depressor labiae inferioris. All muscles of the facial expression, again, supplied by the facial nerve because they are derived from the second pharyngeal arch. So all derivatives of the second pharyngeal arch are supplied by the facial nerve, the nerve for the second pharyngeal arch. Okay. What structure else we can see in the face here? This is parotid gland. This is parotid gland, and this is parotid duct. The parotid duct is run superficial to the masseter muscle and pierce the buccinator. This is buccinator here. Pierce buccinator muscle and open in the vestibule of the oral cavity from inside at the level of second molar maxillary teeth. Blood supply to the face through the facial artery. Yes, as we know, facial artery arises from the external carotid artery facial artery arises from external carotid artery. This is external carotid artery here. External carotid artery. The first branch from anterior aspect of the external carotid artery is superior thyroid. Is superior thyroid artery. Then we have the facial artery and lingual artery. We have lingual first and then facial. The facial artery is leave the neck, turn around the inferior border of the mandible here at this point. So when you put your finger at this point, you can feel the pulsation of the facial artery. Just press at this point here, you can see or you can feel the pulsation of the facial artery. It has a tortuous course. It ascends in the face obliquely like this. It ends at the medial corner or medial conus of the eye as angular artery. It's called angular artery. It has branches on the face, has superior labial. This is superior labial branch. Also has transverse nasal branches, have also mental branches. The second part of this tutorial is about muscle of mastication. We have mainly 4 muscles of mastication are responsible for the movement of the mandible. The 4 muscle arises from the second or developed from the first pharyngeal arch. So all of them are supplied by the motor fibers carried through mandibular division of the trigeminal nerve. This muscle here is temporalis muscle, take origin from the temporal fossa and from the temporal fascia. It inserted to the coronoid process of the mandible. Anteriorly, the coronoid process of the mandible here in the mandible. This is mandible. This is coronoid process of the. This is coronoid process of the mandible. Okay. It elevates the mandible. It elevates the mandible. The second muscle is masseter. Masseter has superficial and deep parts. You can see here only the superficial part of the masseter muscle. It takes origin from the zygomatic process, zygomatic arch, and inserted to the angle of the mandible, lower border here, the mandible on the outer side. So here, again, the mandible. This is the area of insertion of masseter muscle from external surface. The main action is raise the mandible. Then we have 2 pterygoid muscles, medial and lateral pterygoid. Both muscles are deep muscle, arises from the medial lateral surface of the lateral pterygoid blade of the skull. This is the lateral pterygoid blade. The lateral pterygoid arises from the lateral surface. It has two heads. Arises from the lateral surface of the lateral pterygoid blade and from the maxillary tuberosity, so the dorsal surface of the maxilla, to be inserted into the mandible here in the neck of the mandible. At this point here is called pterygoid fovea. So pterygoid fovea for the insertion of the lateral pterygoid muscle. The medial pterygoid muscle arises from the medial surface of the pterygoid blade, of the lateral pterygoid blade, medial surface of the lateral pterygoid blade, side the scaphoid fossa, and it inserted to the pterygoid area. And the pterygoid area, it is a rough area located in the inner surface of the mandible here. At the angle of the mandible, the inner surface of the angle of the mandible, this rough area here is called pterygoid area for insertion of medial pterygoid muscle. Okay, medial pterygoid also for elevate the mandible, and with lateral pterygoid they are move the mandible from side to side during the chewing. Okay, see here in this model you can see clearly the medial pterygoid muscle when it inserted to the internal surface of the angle of the mandible. Here is the angle of the mandible. This is internal surface, and this is medial pterygoid muscle. This here, if you look here carefully, you can see again the lateral pterygoid when it goes to insert to the neck of the mandible in the pterygoid fovea. Here, this is lateral pterygoid muscle. Or I can show you here more clearly. See here, this is lateral pterygoid muscle when it goes to insert into the pterygoid fovea, and this is medial pterygoid muscle when it goes to insert the internal surface of the angle of the mandible. In this part, we will discuss a little bit about the scalp. As you know, scalp is abbreviation of 5 layers that cover the head. It extends anteriorly from the eyebrows to the nuchal line, superior nuchal line posteriorly, and to the superior temporal lines laterally. Overall, surgeons said that every area covered by hair, like this area here in the temple, also is part of the scalp. So the forehead region is overlap between the scalp and face. The layer of the scalp is skin. First one is skin. As we know, the skin of the scalp is the thickest skin in the body, and it contains sebaceous gland and rich in hair follicles, so it's prone to cyst and folliculitis. The second layer is a connective tissue, and it can be difficult to separate from the skin. The third layer is gallia aponeurotica, or the aponeurosis. This is a flat sheet of dense regular connective tissue connect the two belly of occipitofrontalis. This is frontal belly. This is here occipital belly. It is continuous laterally here with temporal fascia, with superficial temporal fascia. So gallia aponeurotica, the upper three layers of the scalp are firmly attached to each other. They are moved as one unit. They move as one unit. Then below to the aponeurosis, we have loose areolar connective tissue. Of course, here because of the fixation, you can't feel the loose areolar connective tissue. And then below to it, we find the periosteum of the scalp. So again, skin, connective tissue, aponeurosis, loose areolar connective tissue, and periosteum. The most important thing here, the loose areolar connective tissue is rich in blood supply, and it is a site or called the dangerous area of the scalp because the emissary vein connect the vein of the scalp to the intracranial venous sinuses. What else here? The nerve supply of the scalp. The nerve supply to the scalp, we have the supraorbital and supratrochlear supply the frontal part. As we know, supraorbital and supratrochlear arises from the frontal branch of the ophthalmic division of the trigeminal nerve. Laterally, we have the zygomatico-temporal. Here's no zygomatico-temporal branch. Yes, this one. Zygomatico-temporal branch from the maxillary division of trigeminal nerve. Okay, so we have supraorbital, supratrochlear, zygomatico-temporal branch, and we have one motor branch for the temporalis. It comes from the facial, from the facial nerve. One motor for the temporal branch to supply the frontal belly of occipitofrontalis muscle. Okay. Then the nerves that supply the scalp behind the auricle, we have posterior division of great auricular. It's come from C2 and C3 cervical segment. We have the lesser occipital from C2, and we have greater occipital, branch supply the occipit region or the posterior aspect of the scalp. For the blood supply, again, it is correspond actually to the nerves. You have supratrochlear, supraorbital for the region of the forehead. We have superficial temporal artery, the branches superficial temporal artery to supply the lateral aspect of the scalp. We have the posterior auricular, and then we have the occipital artery. All of them are derived from external carotid artery, except supraorbital and supratrochlear are derived from the internal carotid artery through ophthalmic.